you know, as a Scottish Canadian Californian, I've always believed that the three-tiered formulary is an inherently American phenomenon. You get what you pay for. If you want to trade up to the brand name drug and there's no evidence that it's any different from the generic, do it with your own money, okay? And I think that's what's really attractive about some of these reference pricing models you talked about earlier. The whole notion that, you know, if you want to go to one set of providers who are have agreed to a particular cost threshold, and if you want to go away from them to somebody else where there's no evidence that they're any better, but they're much more expensive, you pay the difference. That seems to be an important sort of mindset to bring. But it really depends on having very good data at a level of granularity that matters to the consumer. It doesn't help me that I know that Stanford is good at something versus Palo Alto in the very aggregate. You know, if I'm going to have a procedure, I want to know my doctor is actually cheaper. How do you get over that problem?
Well, we've been working on physician level data for years. It's been very challenging because a lot of the medical societies and some of the other organizations in the state are not supportive of having physician level information available to consumers. But we've been through the mill on developing methodologies, data collection systems that pass the test of the New York Attorney General and all kinds of other scrutiny. So we think we've got it right, and as you may know, part of the reform bill is creating a physician compare website, which actually debuts this week, where Medicare will publish data on individual doctors. It's going to take them about 4 years to get it done, but we're ahead of the pack in developing the methods to do that in California. We've actually got data now on 13,000 California individual doctors, comparing their performance on about a dozen different quality metrics. And actually one of the health plans in California, Blue Shield, has been publishing this as part of their provider directory. So if you're a member of that health plan, you want to choose a doctor, you can go on their website and see which doctors are doing better on these quality measures. So I think that's a very important but small step down the road that we have to go. And I think to your point about reference pricing, we don't want to drive people to the low-cost providers. That's not our goal. Our goal is to get people into the hands of high-quality providers that deliver affordable care. And we need evidence that says, you know, why shouldn't I go to the low-cost provider? Show me the data that says you're delivering high-quality care. So we need to put the burden back on the provider community to produce evidence that they're delivering good outcomes, following the best evidence and delivering the care they can. So the consumer should know that. When we talk with our members about a reference pricing model, we are insisting that the quality data be part of the package. That I want to know the list of affordable hospitals or doctors, and anybody under that line who's affordable has to show me the goods on their quality performance. Because I want to be able to reassure my employee they're going to a high quality provider.